Okay, this time I'm going to help female patient perineal care. Perineal care actually you do whenever you change diapers or you help patient for the bedpan and stuff like that. This is separate skills, but you always do it together with other skills. Okay. Knock knock. Curtain for the privacy. Hi, Mrs. Smith. How are you? I'm gonna help you clean your bottom, okay? By the way, my name is Eurina, your CNA, and then I'll be right back with the equipment, okay? Now ready. So we'll get the equipment for the pericare. We have one big towel, maybe mid-sized towel, all right, 2 of them, and then you need 2 washcloths. Okay. And then you need a water basin. Try with the warm water. Run the water a little bit to get warm. And you have gloves. Check the water temperature. Warm. Get the water. And then you need soap. Okay. Okay, Mrs. Smith, let's put this table in this direction so then I can help you easier. And I'm going to raise the bed a little bit up so then I don't bend my back too much. Okay, so raise the bed. Very good. Before I do that, I'm going to ask Miss Smith the water temperature. Mrs. Smith, can you check the water temperature? Is it okay? Good. Thank you. Now, since you're gonna position the patient, you wear the gloves. Okay. And let's maybe lower the head of the bed just a little bit. So then eventually when she's ready to turn to the side, when I clean her back, it's going to be easy for her. Okay, Mrs. Smith, I'm going to take the cover out, make sure she's covered. Okay, okay, Mrs. Smith. I'm going to put one towel behind you, Mrs. Smith. So maybe can you turn to the side? If you can lift your bottom, you can do that. But since you cannot, I'll help you turn to the side. Okay? Okay, arms here. Now you're going to turn just a little bit, okay? Just a little bit so that I can put the towel behind you. Ready? Okay. 1, 2, 3, turn. Just a little bit. Then you put the towels here. Make sure patient is not too exposed. Okay, turn back. Okay, very good, Mrs. Smith. One other towel to cover the bottom and the top. And then now you're going to remove her gown from under the towel so then she's not exposed too much. Okay. Okay, Mrs. Smith, also would you bend your knee and spread your leg? Very good. And this side too. Bend, spread a little bit. Very good. So then eventually I can see the good side of it. Okay. Now, one for the front and one for the back. Washcloth, making a mitten. Okay. Put the soap. Okay. Now, this time my left hand, I have 2 fingers to hold and spread it open to stable. stabilize, and then I'm going to use my mitten to clean. Okay, Mrs. Smith, I'm going to go ahead and clean your bottom, okay? Okay, open the towel and spread the labia, and then you clean. When you clean, one stroke from front to the back, front to back. Now you turn around, front to back. Okay. Okay. This time you're gonna rinse. Make a mitten. Same thing, front to back, front to back. Okay. Now I'm gonna rinse. Okay. You open, spread it, front to back, turn, front to back. Very good. And then you can clean front to back, front to back. Very good. And you're done your front. Okay, straight your leg. Okay, Mrs. Smith, you cover the gown on and you remove the towel out. Make sure she's covered. Mrs. Smith, I'm gonna clean your bottom, especially your back, okay? So you need to turn to the side. Bend your knee. Okay, very good. And then arms holding. Can you turn to the side? 1, 2, 3. Turn. Very good. Now you open. Make sure you have towels. Okay. This time the second washcloth, you wet it. You squeeze the water out. Get the soap. This time one stroke. Patience front to the back. Patience front to the back. Very good. Now you rinse. Squeeze the water out. Now you're gonna clean. I'm gonna clean your bottom, Mrs. Smith. Front to the back. Okay, and you're done. And use a towel to kind of clean. Okay, you check patient's skin and she's good. So you're done. Okay, Mrs. Smith, now you can turn back. Very good. Okay. Since earlier you used your hand so much, so you use your right hand, which was covered by mitten. This hand is dirty. Just cover the patient. Mrs. Smith, I'm gonna remove my gloves, wash my hand, and I'll clean the mess, and I'll be back and make you comfortable a little bit later on. Okay? I'll be right back, ma'am. And get your soiled towels. Okay. And return to the side. Soil linen in the hamper. Remove the gloves. By the way, you can rinse the container first and then you can remove the gloves. Okay. Now you wash your hand at least 15 seconds. Okay. And you check the patient one more time. Mrs. Smith, you alright? Okay. Maybe it's a little bit comfortable. Okay. You look comfortable. You feel clean too? Okay. Now here's your call light. If you need me, call me. Okay. Side wheels up. And you scan the room. She's safe. She's comfortable. And you're done. You're clean. And you're done. You open the curtain. You already washed your hand earlier. So you're done. Okay.